let's talk about a number of antiviral medications used for viral infections. And just like fungal infections, viral infections come in every shape, size, and form, everywhere from the common cold up to pneumonia and hepatitis and STIs and eye infections and skin infections and just about everywhere a virus can hit you, and we have a host of medications to combat these viruses depending on what it is and where it is. So instead of going through every single little virus and every little single, let's highlight a few and talk about just a handful of pretty common viruses and what we're going to do about them. First, we're going to talk about is respiratory syncytial virus. This is RSV. Very common in infants and children, especially in kind of late fall into the winter months. It's kind of RSV season. This is a bronchiolitis. It is kind of like bronchitis, except it affects your bronchioles or the child's bronchioles, so it's a bronchiolitis. And we've got ribavirin for that. So, most commonly, your pediatrician's going to monitor the child, but if it's bad enough, we're going to give them this very specific antiviral for RSV. So this Virazole is for RSV. It's kind of a frontline drug for RSV if the child needs it. Otherwise, we're just going to ride it out, monitor the symptoms, control any type of fever, um, and respiratory issues. But if we need to treat the virus itself, this is the drug we're going for. Let's talk about our herpes viruses. So they come in a few flavors. We've got our herpes simplex virus, which causes both genital herpes and cold sores. Our cold sores are HSV1, our genital herpes HSV2, so those kind of come in a couple different brands themselves. Then we've got our varicella zoster viruses, which are another type of herpes virus. These cause chickenpox. You've probably been vaccinated against chickenpox, varicella. If you get chickenpox, it lives in your body, so these herpes viruses never go away. So chickenpox lives in your body and may come back as shingles later on. So we've got herpes simplex, we've got these varicella zoster viruses, and they just live in your body. So we're never actually going to get rid of them, even if you had chickenpox, even if you had cold sores, whenever. You're never actually going to get rid of and cure, quote unquote, cure these viruses. So what are we going to do? Well, we're going to go after them, and we are going to try to kind of keep them contained. For HSV, uh, pretty common medication is Valtrex or valacyclovir, and for your cold sores, pretty common. You can get this over the counter is Abreva. So these treat these outbreaks, and then we try to control and kind of diminish outbreaks. We don't want them coming up over and over and over again. And when they do, we can treat them in the moment. So with these viruses, it's all about replication prevention. So with Valtrex and talking about HSV, so we are both shortening the time of healing of these outbreak lesions, and we're reducing what's called viral shedding. So even though you don't have an outbreak, you're still kind of contagious. Because of viral shedding, and we're reducing viral shedding. So we are reducing um, contagiousness, and if we do have an outbreak, we are shortening the healing time there. But again, these drugs, these medications do not eliminate this virus. They don't eliminate HSV. They don't eliminate varicella zoster. So if you have it, you have it, and you'll just have outbreaks every now and then. It just lives in your body. We don't have an actual cure to get rid of these viruses. And then just as common is influenza. So I'm sure you've had the flu before. That is a type of virus. We have some very specific types of influenza, and they're all typed H something N something. So our H3N2 is our pretty typical common flu. And that's the one we're going to have these flu shots for you every single year, hoping to kind of hone in on the most common strain of that H3N2, but we've had a couple kind of outbreaks in the past 10 years or so. We've had H1N1, which was our swine flu. We've had H5N1, which was our avian flu, and had these like really weird variations and of them. So you get the common flu. Usually we kind of ride it out and manage our symptoms and take some Dayquil, take some NyQuil, take some ibuprofen, try to keep down that fever, right, that flu, and then if we need, we can get this Tamiflu. So you're noticing probably that all of our antiviral medications end in VIR, that VIR. So if you see a medication that ends in VIR, that is an antiviral medication. And the one here for the common flu and pretty typical flus is going to be this Tamiflu. And then lastly, when talking about antivirals, we have to talk about HIV. And in HIV, the goal of this antiviral therapy, this antiretroviral therapy, because HIV is a retrovirus, the antiretroviral therapy is to, one, reduce viral load. So that reduces both symptoms and reduces the chance of passing it to someone else. We want to restore and preserve the immune system because HIV, we know, just wreaks havoc on the immune system and just renders it useless. So we want to preserve it, we want to restore it. With that, we are improving quality of life and we are reducing the chance of sickness, we're reducing the chance of death from HIV. So that's the goals of this therapy for patients with active HIV. And we're not just using one medication for HIV. All your patients are going to be on multi-drug therapy because we have to attack this virus from multiple angles, from every angle that we can. We have to go after this virus. So patients going to be on multiple medications when battling HIV. When we say they're going to be on multiple medications, I mean here are the like 9 common HIV medications. There are many more out there, but here are the common ones. So they might be on 2 or 3 or 4 or 5 of these. So their physician's going to pick kind of this cocktail of medications to go after this virus. And how do we pick which of these medications to go after the virus? Do we just throw all 9 at them? Do we pick 3 or 4? Well, they all kind of do a little bit like different things. They come from different angles. All these angles still go after this HIV, this virus, both again inside outside of the T cell where it lives, right? So we've got fusion inhibitors, we've got transcriptase inhibitors, both going after the nucleotide and the non-nucleotide or non-nuclear side. We've got protease inhibitors, so we've got all these different types of antiretroviral drugs going after the same virus just from different areas to really just like knock it down and kick it out, right? To really go after it and try to kill it and control it as much as possible to um, to preserve as much of the immune system as possible.